Connie, when I talked with parents earlier today, most had no idea that these new guidelines for vaccines had even come out. These new restrictions represent a big change in policy from just 1 year ago. Inside Glowworm Play Cafe, you can readily find hand sanitizer, a must-have accessory during the height of the pandemic.
We have a very rigorous cleaning process and schedule and everything like that. And we opened during COVID, and so it's always been top of mind for us to keep it as clean as possible.
Katie Reed, the owner of the cafe, has 2 young kids of her own, and COVID concerns are never far from her mind.
We follow the guidelines that our pediatrician recommends for us. When we're due for shots, we get our shots.
The previous U.S. policy about COVID vaccines recommended them for anyone over 6 months old. The FDA now only approves seniors 65 and older for the vaccines. And for the rest of us,
where the change comes is those under the age of, that is 64 and under, with no chronic medical condition. They're not actually recommending it for them.
Definitely a big turn.
Nakia Connor says she has not been paying as much attention to the recent changes in policy, just focused on her own health.
No. Okay. If anything changes, I may change my mind, but as of right now, no.
All this comes as Dr. Mark Burns, an infectious disease expert at U of L Health, says we are seeing a small rise in COVID cases.
They're a little bit higher than what they were 2, 3, 4 months ago.
For those who fall outside the new guidelines for a vaccine, he says to talk with a medical professional.
And then they can give you more information on the risk benefit. And then together you can make decisions on whether you want to receive the vaccine or not.
Which is exactly what Reed and her family will continue doing.
And that they're going to recommend what's best for our family.
If your insurance does not cover a COVID vaccine in the future, obtaining one could cost as much as $150 or more. Now, there is some pushback against these new guidelines because of access for families, including criticism from the American Academy of Pediatrics. Conrad Delouche, WHAS 11 on your side.